So this is the dead bug. The goal of the dead bug is deep transverse abdominis strengthening. The transverse abdominis is that deep corset tissue that goes circumferentially deep all the way against the spine, under the six-pack, under all the abdominal muscles. So you're going to take the athlete or the patient. They're going to get into a hands and knees kind of crawling position. So both arms are going to come straight overhead towards the ceiling there. Knees are going to pull up and be bent. So now in this position, there should be very mild stress to the trunk. Here's how we make it a little more aggressive. By taking that sternum, painting it down into the abs, the head's going to lift up slightly. It's about that sternum. It's not about cranking the neck up. So you're going to hold that position for an isometric of 10 seconds, contracted, no movement. Then go ahead and fully rest. Okay, so that's phase one. Just trying to get some stamina, get some activation in that position. Now we start to move the limbs away from midline. So we go back to that kind of tabletop crawl position, get set up, tacking down at the ribs. One limb at a time is going to slowly lower back down. Holding this neutrality here, not letting that system give up and flare is the goal. We'll go ahead and transition limbs. Now with the weight of the legs, this is where it gets a little spicier. You're going to slowly straighten. Good, we'll go working right into that diagonal. Good, keeping a great neutral midline and fully rest again. So the amount of reps that you're doing, the duration that the time that you're taking to slowly lower and lengthen, all of that is dependent on keeping that tacked in midline. If you lose this position, you start to open up, just be done. Just be resting. Okay. Otherwise, what we kind of essentially risk is then the larger muscles, the hip flexors that are probably already overactive, then start to bully, and that's not really our intention. Okay. There's a little hybrid off of the dead bug here that we'll do now. It's called a bent knee fallout. So we go back to that tabletop crawl position. And then now, for a bent knee fallout, the leg is just going to slowly open out, lower down as far as controlled, slowly return back up to tabletop position, and then this leg now is stationary and the opposite leg will fall. And then come on back up and rest. Good. And that's the dead bug.